There's a red line buried in there too that I want to bring everybody's attention to, because that red line is the number of patients we have in an intensive care unit at any point in time. And when you look at the experience here in the past week or so, we are at the highest level we've ever been in the pandemic. And that is what is very, very concerning. So the acuity of the patients that we're caring for is very, very high, and it's putting a tremendous amount of pressure on our health system. The pressure is so high that it's affected our ability to perform scheduled procedures for patients who need to come in to have a surgical procedure or another procedure performed where they might need to be hospitalized. We're now needing to delay some of those so that we can create capacity in our system to care for the patients under our care and the emergencies that are happening every day. And so that's why we wanted to get back together with our community and talk a little bit about what we're seeing with COVID. There's another graphic that we've been sharing on Facebook that I think is very telling. And that graphic talks about really the benefits of vaccination against COVID-19. And so this is our experience, 68 inpatients. You can see the unvaccinated individuals, they're represented with the yellow stick figures in the graphic. Vaccinated individuals that we're caring for COVID-19, they're represented with the green stick figures in the graphic. And so of those 68 inpatients, 62 are unvaccinated. In fact, every single patient in our intensive care unit and every patient on a ventilator is unvaccinated against COVID-19. You can also see the breakdown there. We're now caring for more inpatients that are under the age of 65 than we are above the age of 65. And all of those under the age of 65 that we're caring for are unvaccinated. All of this could have been prevented by a simple vaccination against COVID-19. These vaccines are very, very effective against COVID-19. I hear some people in the community talk about how, hey, if you get vaccinated, you could still catch COVID. There are some breakthrough infections, but the vaccines, you're not just one time, twice as unlikely to catch COVID-19, 3 times as unlikely to catch COVID-19, 4 times. That sounds pretty amazing, right? I'm 4 times less likely to catch COVID if I'm vaccinated. 5 times. You're over 7 times less likely to catch COVID by being vaccinated than if you're unvaccinated. These vaccines are still extraordinarily protective against contracting COVID-19. And then if you do happen to contract it, your risk of serious illness is significantly less if you're vaccinated because your body has already been primed to be able to fight the virus. And so I encourage everybody, if you care about anybody in this world, right? If there's anybody that you love, a family member, children, a spouse, parents, if you love anybody, vaccinate yourself to protect them. Okay, it's the best health decision that you can make at this point in time. Get vaccinated against COVID-19. Protect not just yourself, but every single individual that you love.
Thank you, Dr. McDermott. Some of our patients, you had mentioned this, that some of our patients may have had a scheduled procedure recently postponed or rescheduled. Can you give a little bit? Can we get a little more detail about that decision to postpone, how long we expect it to happen, and what kinds of cases we've decided to postpone?
I can speak
Dr.
a little
Newman?
bit to that. Yeah.
Thank you.
So, our healthcare system is currently at capacity. We have no ability to take care of additional people. We're really stressed. Our healthcare teams are working tirelessly around the clock to be there for our community, in our emergency room, in our intensive care unit, and throughout our hospitals. But this is not just a Fredericksburg problem. This is not just a Mary Washington problem. Eileen and I were on a call with state leaders last week across the state, healthcare officials. Every single region in Virginia right now is maxed out. So if somebody at a smaller hospital has something where they need to be transferred to a larger hospital, there is not that capacity. There's very, very limited capacity. Some healthcare leaders were talking about transferring patients hundreds of miles for care to Pittsburgh and Philadelphia and some other large population centers outside of the Commonwealth for care. So this is a very serious issue. This is not just about COVID. This is about anybody coming to our health system that needs care and being there for them, and for us being able to provide care if you had a car accident, a cardiac problem, anything, a stroke. So what we've had to do to have some capacity is limit surgeries for which afterwards you would need to be hospitalized. So scheduled surgeries. These are not elective, surgeries that you really want to delay. And those are the concerns. These are individuals who need heart surgeries. These are individuals who need cancer surgeries and others. And right now we've put a 2-week delay on those. And we have a group of our medical staff, anesthesiologists and surgeons and medical staff leaders looking at each one of these cases and the safety of being able to put that procedure off a week or two. But it's all highly concerning, and really unvaccinated individuals in our community are creating this bottleneck, not only here, but throughout the state. And they're preventing all of us having access to healthcare or the capacity to access healthcare. So at this point, we put a 2-week sort of moratorium on elective surgeries. We are looking at each one of those surgeries that's being rescheduled for safety. Medical staff leaders are looking at those, and we'll continue to reassess as we look at our capacity. But we have no ability to transfer patients outside of our health system to anywhere else because nowhere else has that ability to take them.
I think that's a key point, Chris. The unvaccinated individuals in our community are creating a crisis in healthcare for everybody, the vaccinated and unvaccinated, who might require emergent care. And so, vaccination, everybody thinks it's a personal choice, but it's not. Those choices are affecting the healthcare of everybody in our community at the current moment. And vaccination is a routine public health requirement in a civilized society. If we all want to enjoy the benefits of living in a civilization, going into grocery stores with one another, we need to protect ourselves, if we can, against contagious diseases, especially life-threatening contagious diseases like COVID-19. And so everybody needs to get vaccinated. We need to do it for one another's sake, for the health and safety of everybody in our community.